Okay, so I have my script in front of me. So if I had this patient, I'd start by introducing myself. So I'd say, hi, my name is Abby, and I'm gonna be your nurse today. How are you feeling? Okay, can I get your name and date of birth? Perfect. Can I get you anything right now? Are you doing okay? Okay. First, I wanna discuss about your upcoming procedure and get a follow-up scheduled before we start the actual procedure. That way, when it's done, you can just get on out of here and go home. Today we're going to be performing what's called a Mohs surgery to remove the basal cell carcinoma from your cheek. The diagnosis means that you have cancerous cells that have grown in the basal layer of your skin. It can sometimes spread to other areas, but we have caught it early enough to where that chance is pretty low. If you have any questions, feel free to ask while we move along. Dr. Moore will be performing the procedure. He's the dermatologist here in our office. It's a relatively simple surgical procedure. Well, we will start by numbing your left cheek entirely before taking a biopsy. And that's just where we will kind of take the top, a sample from the top layer of that skin, send it to the lab to be analyzed for cancerous cells, and depending on where those are and how many cancerous cells there are, determines if we need to take another layer of tissue. And we'll keep taking layer by layer, sending it off to the lab until there are no cancerous cells left. Once all those cells are cleared, we'll stop removing the layers, and Dr. Moore will stitch up that wound. This procedure may take several hours depending on how many layers we do need to remove and how far down the cancer has spread. You may experience some edema or localized swelling in that area immediately following the procedure, and that may last about 1 to 2 weeks. There is a chance of scarring as well. Staying diligent about your post-op wound care and following discharge instructions closely will minimize that risk. There is also a risk of keloids, which are raised dark scars that can occur if post-op care instructions aren't followed correctly. We would like to see you in 1 to 2 weeks to remove those stitches, and it might be a good idea to schedule a follow-up with your primary care physician as well. Removing the stitches should take about an hour or so. Is there a day that works best for you? Friday works best, so we can do next Friday at 2 in the afternoon. So I'll go ahead and get you down for that, and we will send a reminder email the day before. If you have any other questions or concerns, feel free to ask any of us at any time.